Okay, guys, so today I'm here to talk to you about a concept called lean methodology in healthcare. My name is Jake Saelens. I'm a senior at the University of Missouri, and I'm a health science major with aspirations to become a physical therapist. Lean methodology is a concept that came over from Japan that we're trying to adapt into our healthcare system that could be very beneficial to many people in the United States. What is lean methodology? Lean methodology, or lean production, is a systematic method for the elimination of waste within a manufacturing or production system. Lean also takes into account waste created through overburden and waste created through unevenness in workloads. Like I said, lean is an improvement approach developed by Toyota Motor Company in Japan that was carried over to the United States by word of mouth and see if it would work here. Lean is basically about getting the right things to the right place at the right time in the right quantities while minimizing waste and being flexible and open to change. This lean concept focuses on what the customer values, and any activity that the customer does not value is considered to be wasteful. It is basically using less to do much, much more in the healthcare industry. So, how does lean methodology apply to healthcare in the United States? Lean thinking in healthcare is applied rigorously and throughout an entire organization to demonstrate a positive impact on productivity, cost, quality, and timely delivery of medicinal or health-related services. It examines organizational processes from a customer perspective with the goal of limiting the use of resources to those processes that create value with the end customer. The main goal of lean methodology is to benefit the patient with as much health-related service that they need while eliminating barriers and all these wasteful actions that stand in the way in many healthcare facilities nowadays. These patient benefits come from a joint focus on improving the work life for medical providers and hospital staff, improving processes to prevent systemic errors, reducing stress levels, and reducing waste so that the hospital personnel can spend more time and focus more on patient care than worrying about logistics and management errors in the healthcare setting. So what healthcare management strategies that we learned about in our book are present in the concept of this lean methodology? So when it comes to delegating resources and coordinating activity in the hospital or any health-related setting, the manager must step up as an authoritative individual to know what the patient or customer wants, as well as how the manager is going to provide that service with the least amount of waste involved. Lean methodology or management is all about customer satisfaction at the most effective overall rate. In this lean methodology, there are 5 common to the leadership involved with taking this lean and to get it to its full potential. The first common core is the value of the customer. That is the most important when dealing in healthcare. It is always to please the patient first. Secondly is everybody's values, which means the provider as well as anybody involved in the healthcare setting. Also, the third one is making the actions towards gaining the flow of resources easily. You don't want any mess-ups when it comes to logistics. Only delivering what is required when it is required is another common core to leadership. This takes away any waste that could happen. And the fifth one is to strive for perfection by removing these unnecessary layers of waste that may be present or may act as barriers in the healthcare setting. Okay, so now I have a little video to show you guys. It's from the Lean Enterprise Institute, and they actually offer a 2-day class that gives you the key concepts of lean in healthcare and how it could be beneficial to many healthcare settings in the United States.
Hi, I'm Mark Raven, Senior Fellow at the Lean Enterprise Institute, and I'm going to be teaching a 2-day course called Key Concepts of Lean in Healthcare. And our intent here is to have an introductory course that helps introduce people from different healthcare settings, including hospitals, outpatient clinics, primary care, settings like that, to the Lean methodology. So we'll start off by talking about the types of problems that healthcare organizations are solving with Lean, how they're improving quality, improving patient safety, reducing waiting times, improving cost, and improving staff satisfaction through not just the Lean tools and the methods like 5S, standardized work, A3 problem-solving methodologies. We'll talk about those methods, but we'll also talk about the management system, the philosophy, and lean from a conceptual level. So we're hoping that you'll be able to go back to your organization after this course, where we'll have lecture-based teaching, but we'll also have a lot of discussion within the class, hands-on exercises, scenarios and examples built completely around healthcare situations, that you'll be able to go back to your organization and articulate why lean, what lean is and how it applies in a healthcare setting, and also have an action plan that you can go back with to articulate to your senior leadership, your board, your hospital staff, even your community about what it is that you hope to accomplish and what you plan to accomplish using the lean methodology in healthcare.
Okay, so as you can see, as Mark said, lean has a lot of little minor things to it that you could actually take this 2-day class that is offered at the Lean Enterprise Institute to learn these concepts and to flourish them into the new healthcare system that you are trying to accomplish. So when do you use this lean methodology in healthcare? It's evident that you must use lean methodology when the work you are performing is not aimed at benefiting the patient in the end of your scheme. Also, it is important to include lean methodology into a healthcare organization when the supervisor notices a drastic decline in crucial medical resources and also notices the trends of how these wasted resources could be altered to benefit the organization and patients as a whole. When there is work or services that do not add value, you can divert resources to those that do add value. It is your ethical responsibility as a healthcare provider to allocate resources in order to maximize health for patients. There is always something more beneficial in the healthcare setting that could be done as opposed to performing wasteful, tedious tasks that are going to get nothing done and go against this concept of lean methodology. So here's a little chart based on what would happen in a lean methodology type technique if they were used in the hospital or in any sort of clinic. As you could see, you could zoom up on it. With a wait time of 3 days and a clinical face care time of 285 minutes. That is actually extremely good for healthcare providing, and that's usually not as much time, and that is way less waiting time than you would have to for normal healthcare if the methodology was not included. So why use this lean as it's continued? As you can see from viewing the lean management chart, the patient was given 2 steps of action after their initial contact with the healthcare provider, their physician at the clinic, in order to make an appointment. After the appointment and the necessary tests were completed, the patient found out there was only a waiting period of 3 days as opposed to normal 33 days to when that patient found out that their test results could schedule their follow-up visits with the physician according to what the diagnosis was based on the expedited test results. They only received 285 minutes of actual face-to-face with the physician in this month period, which is very normal but considerably high for healthcare providers. The patient received efficient care at an extremely rapid and effective rate, and they now know that the status of their health a month earlier than they would have normally. This is because of the elimination of the wasteful middleman techniques onto why this patient has been provided the best health care possible. Due to our increases in medical technology every year in the United States, the speed of experimental tests and trials can be expedited. The management group has to enforce these core lean principles. So after using lean methodology, what is the product then? Implementing the core values of lean management can create influential benefits and high reliability for many healthcare organizations. One who aims for the maximum benefit of lean methodology will achieve the following: the highest quality of patient care, the delivery of reliable care, the lowest cost possible of healthcare, the highest levels of patient safety, and the highest morale of employees and patients in the healthcare setting. The hospital or healthcare organization benefits in a long-term perspective due to reduced capital costs and ongoing expenditures, growth opportunities created by freed up capacity of the workers, and an improved reputation that results from better quality and service in the end. So now I'll tell you why I think every hospital or healthcare setting should follow a lean methodology system. Besides for spending less money on medical resources and saving time in the process, implementing lean methodology into healthcare gives the patient what they want when they want it. As healthcare providers, all of us want to help people. This is finally our call to help people exactly as they would like and save time, money, and resources in the process. There are no unnecessary delays or waiting processes involved with this management principle, and I personally, as a healthcare manager, would push for more hospitals and clinics to follow lean methodology. Every patient in the United States is entitled to their own distributive justice, and it is our responsibility as healthcare providers to give every American an equal opportunity to utilize their care to its maximum potential, and I firmly believe that this could be accomplished through implementing this lean methodology into American healthcare. Thank you very much for your time and for watching my presentation.